Our top story now, a big focus on the show. A mutation of coronavirus known as E484K and feared to make vaccines less effective has occurred spontaneously in the fast-spreading variant that has now taken hold in the United Kingdom, which is referred to as the Kent variant because it spread first in the Kent area. Experts in the country have said that this, in their latest assessment of the outbreak, that this further mutation has taken place. Although this change may reduce the vaccine effectiveness, the current ones in use should still work, according to the experts. Well, to talk more about this mutation and what it means, especially what it means for the vaccines, we're now joined by Dr. Ravindra Gupta, who is part of this study on the variant. Now, Doctor, there are reports that the UK virus has further mutated. Also, this could affect the vaccine. So tell us what we know so far.
Yes, so we've undertaken a study in patients who have been vaccinated with the Pfizer vaccine, had the first dose, and we took blood from them 3 weeks after the first dose, so they should have reasonable antibody levels. And then what we've done is we have made artificial viruses in the lab. Now, of course, we have a number of different viruses at the moment. We have the one which was circulating before December last year. That's what we call the wild type. Then we have the B117, which everyone knows about. It's everywhere in the UK. It's in 80 different countries now. And then there's the detection of a new variant. Well, it's not really a variant. It's a mutation on top of the B117 that is causing some concern, because this additional mutation is at position 484 in the spike protein, and that is a major mutation in the South African and Brazilian variants, which people are very concerned about and which potentially are reducing vaccine efficacy. So we've established that there are a number of these sequences in the UK. They appear to be transmitting, and this is of significant concern. So what we did is we made that virus as well, and tested all three viruses against the blood from these volunteers who had antibodies because of the vaccine. So we found that the B117 variant was 2 or 3-fold less sensitive, and that's fairly modest. It's what we expect. The vaccine won't work quite as well against the new B117 variant. For most people, that should be fine, but things may get more complicated as you lose immunity because over time the antibodies go or they disappear. And secondly, if you're elderly, then of course your immune system doesn't work so well. And but more importantly, most worryingly, with this new variant, this new mutated version of B117, this one was nearly 10 times less sensitive, and that's where in the kind of area where I start worrying that that this may have an impact on how efficacious the vaccine is. The vaccine will probably still prevent death and severe illness, but the virus still may be able to replicate and cause some degree of illness and more severe disease if people are immune compromised or older.
Right, so what does this mean again for the vaccines? What impact does this have on efficacy? If you could explain that in more detail, and what should vaccine makers do?
Well, many of the manufacturers are already making plans to change the vaccines because of the new mutations that we're seeing in the UK and in other places. So what's happening is that the viruses in different parts of the world are demonstrating similar mutations in the same places. So we have an idea of where we need to change our vaccines first and foremost. So it's good that we've seen the variants in many ways this early, because it gives manufacturers a chance to go and change the vaccines before next winter, hopefully.
All right. Now, earlier there were reports that the UK virus was more infectious, and that later it was said that it could cause a more severe disease. Do we know for sure yet about this?
Well, the B117 does spread more rapidly. That's why it has overtaken all the other strains. But whether it causes more death, I'm not sure. I think there are still mixed opinions, mixed studies, mixed results. I think that we should focus on getting the transmission down, because that's how you reduce death in the most important way. I think that that's the key thing here. And of course, scaling up vaccines as quickly as possible.
Now, currently in the UK, if we talk about, the vaccination policy, there's a big gap between the first and second doses. This was something that was controversial. Is it seen to be working yet? Now, there's this study that has just been released, which says the AstraZeneca vaccine is working even after just the first dose. If you could tell us about that.
Yes, I mean, in the UK, we've decided to use our resources and spare them and cover as many people as possible. The UK is now vaccinated to think something like 10 million people out of 60 million. So it's 16%, which is pretty good. And there is a longer gap between the vaccine doses. Now, different vaccines will be impacted in different ways. We showed in a study pre-printed yesterday that if you are over 80 and you received the Pfizer vaccine, then nearly half of the individuals had very poor protective antibodies after the first dose. And when they had the second dose at the proper time, 3 weeks, they then mounted very good responses, similar to the people younger than them. So that tells us that that extending the dose interval for the Pfizer vaccine is probably not a good idea for people who are vulnerable to severe infections, such as the over 80s. Now, the AstraZeneca vaccine is a different vaccine, and this vaccine appears to have increasing efficacy or antibody levels over time after the first dose. And therefore, with this vaccine, the 12-week interval may be okay for everybody, but we need to double check that. The clinical trial had very few people over the age of 80, and of course, trials obviously select young, healthy people in general. So we need to take it with a pinch of salt, and we need to see data for all age groups.
Now, talking about vaccine strategies, there's also talk of clubbing vaccines like AstraZeneca, Oxford vaccine, as well as the Russian vaccine for better impact. This is another, something that is being tested there in the UK. This is interesting for us in India because, we're using the Oxford vaccine and soon we'll also have the Russian vaccine. So what can you tell us about this clubbing of vaccines?
Yes, this is particularly important in vaccines that are using common cold viruses like the Sputnik vaccine or even AstraZeneca that use adenovirus. So when you see a virus, even if it's in a vaccine, you make antibodies to it. So there will be people with antibodies to these vaccines after the first dose, and therefore using a different vaccine that's slightly different or different technology is potentially a good option. But mixing two adenovirus vaccines that are identical, probably not going to achieve what is aimed. So you need to have a different type of vaccine, ideally, if you're going to use this approach. I think it will probably be okay, and I think people have to be realistic and pragmatic about vaccination. We need to just get vaccinating as quickly as possible. I think if we're going to mix vaccines, we should be studying the effects of it properly in large scale, and that's being planned in the UK if that goes ahead. So it shouldn't just be a lost opportunity for research. So we need to use it as to inform science for the next stage, because we're going to need vaccines for quite some time.
And I have to ask you, what is your view of India's situation? Here in India, the numbers have gone down significantly and there are lots of theories doing the rounds. What is your view?
I mean, I haven't seen the data on how many people have antibodies or who have been infected, but from what I hear from family members, I mean, pretty much everybody has been infected with this virus that I know. So I think there's been a lot of infection. Maybe many are asymptomatically infected and they didn't even know they had it. And so if a lot of people have been infected, maybe that's one reason why the levels are falling, because the lockdown measures were not strict at all in India. So there's no reason why things should be falling or improving, given that measures have been quite relaxed for some time. So I think that this herd immunity argument may be here. But the problem with that is that viruses like the B117 and other mutated viruses may be able to overcome this general immunity and create further epidemics or surges.
Now, there is also talk, one of the theories, because I referred to how there are many theories, there's also talk of how India, you see many diseases every year, every season, you have many viruses and virals doing the rounds, and maybe there's some sort of cross immunity because of that. What do you think?
Yes, I mean, I think that could certainly be part of the story. A lot of exposure to viruses and bacteria could be increasing people's basal levels of immune function and ability to clear the virus. So that's certainly a possibility, but it's not proven at the moment.
All right. Well, thank you so much, Dr. Ravi Gupta, for speaking to us again here at NDTV. Well, let's get to the India numbers now with 12,899 people testing positive for COVID in a day. India's COVID tally has now risen to 1,07,90,183, while recoveries have surged to 1,04,80,455, according to the data released by the Health Ministry, and the death toll has increased to 1,54,703 with 107 new fatalities. The total COVID active cases have remained below 2 lakh so far. Now, if we take a look at the vaccination drive, nearly 45 lakh healthcare and frontline workers have been vaccinated so far in India. 3.1 lakh beneficiaries were vaccinated yesterday, and yesterday was the 19th day of India's vaccination drive. Uttar Pradesh accounts for the maximum share of vaccinated beneficiaries, followed by Rajasthan and then Maharashtra. But there's now a worry as the vaccinations in India are seeing a sharp drop in the numbers, and more doses are now being exported than Indians actually getting vaccinated. Well, to talk more about the vaccine drive, we're now joined by Dr. Gautam Bhansali, Chief Coordinator, Private Hospitals in Mumbai. Thank you so much, Dr. Bhansali, for joining us. So while India reached the 4 million mark very fast, in just 18 days, we crossed 4 million people being vaccinated. There is some concern being expressed by many about how the vaccination drive is somewhat slowing down. Are we still seeing issues of vaccine hesitancy?
No, there is no vaccine hesitancy at all now. Initially, definitely there was some hesitancy because people were thinking that if doctors are not taking, then why frontline people will go and they will take the vaccine. Now, yesterday only we have started vaccination for the frontline worker, and the response is very good. Yes, yesterday in Mumbai, number of cases was little low, like it was 793 people got vaccinated, frontline worker. Today, there are so many frontline workers are there in the queue for the vaccine, and now there is no hesitancy. Earlier, definitely there was some hesitancy because there was some confusion about the Covishield, Covaxin, and there was some different news in the WhatsApp and other places that that vaccine has some side effect or some people may die, or some sort of wrong information was there. But now everybody's on that for the vaccine, and initially there was some problem with that COVID app also. So people were waiting for that their number or their thing, that if that there is some call or some message from that COVID app or some government agency, then they will go and get vaccine. But after that, there was some confusion about that COVID app. Then after that, Municipal Corporation Mumbai started doing walk-in vaccination for the person who registered, like doctors and all that. So after that, turnout is good. Now in Mumbai, that till today, more than 58,000 people got vaccinated. In Maharashtra, more than 3.5 lakh people got vaccinated, like mainly the healthcare staff. So turnout in Mumbai is more than 76%, which is not bad. This is good, you can say.
So in that case, Dr. Bhansali, I have to ask that, if you're saying that now there's no vaccine hesitancy, people are coming out, it's become a lot easier as well. There's more flexibility. People can walk in for the vaccine. So in that case, if we're seeing this drop, or if we're seeing that the rate of vaccination is not as fast as we wanted, what do you think needs to be done? Increase the vaccine centers, get in more private sector to help out with the entire vaccine process. What can be done to increase this rate of vaccination so we actually do vaccinate those 30 crore people by the summer?
Yes, exactly. For that, we demanded, as a chief coordinator for all the private hospital, I already demand that we should involve all private hospital. We should open more and more center for that, because if you are going for the vaccination, then it will take minimum 2 to 3 hours, because you need to reach that place, and then after that you have to be 30 minutes for observation and all the things. That will take total 2 to 3 hour protocol. So if we involve all the private hospital definitely have good health infrastructure. They have the best of the best intensivists, good ICU care, everything. They have good observation area also. So if we involve private hospitals for the vaccination, especially for their own employee, like I'm in Bombay Hospital, we have 2,200 employees who need vaccination. But all 2,200 people need to go to some other place, some other center. And everybody, it's not possible for everybody to go in a working day. and you need transportation or many things are there. So that's why, and people thinking that there is no queue and nothing is there, so we can go and we can get vaccine. So that's why we demand that we should open more center, and private hospitals should allow to give vaccination. Although we have the auditor from the municipal corporation, the monitoring system is there, so we can check, and number of cases will increase. Number of vaccinated people will turn out to be very good. So private partnership should be there. Yeah.
All right, Dr. Bhansali, thank you so much for speaking to NDTV. So some important measures that he's suggesting there, that we should actually get in our private sector, since we have such a vibrant and good private sector in terms of India's medical sector, and maybe that will increase the rate of vaccinations. Well, it's time now for our viewer question segment, and we're now joined by Dr. Uma Kumar, Professor and Head of Department of Rheumatology and AIIMS. Thank you so much, Dr. Uma, for joining us again. Let's listen into the first question.
I am Chirag Khola from Gurugram, and I would like to know that what is long coronavirus and how come some people are affected for so long while others do not get any symptoms?
Dr. Kumar?
Yes, there are two components to his question. One is what is long corona? It is about, having post-COVID effects of infection. Initially one gets, fever, body aches and cough and dyspnea and everything. And when one recovers, but other symptoms they persist, that could be cognitive impairment, that could be having pains and aches here and there, some anxiousness, and even cardiac involvement is happening, pulmonary involvement go on for long. So this is what long corona is. And then he asked why some people get infection, other don't. It's all about your immunity against infections, and on some factors you have control, on others you have no control. If I need to tell him that what decides immunity, primarily it's your diet from the very beginning, your activity, your sleep pattern, your thinking, positivity or negativity. So there are lots of factors which decide immunity over the period of time. So immunity is not changed overnight. So that is why if you get infection, others they don't manage infection, but anybody can get infected. Yeah.
All right, well, let's just listen into the next question.
I'm Jocelyn John from Delhi. Is coronavirus gone? Because everything is opening up.
All right. Well, people can't be blamed for thinking that. She wants to know if COVID is gone because, we're opening up everything.
Right, it will surely go if the people of India they keep following COVID appropriate behavior, right? And it has the incidence of coronavirus has come down just because people are listening and they are following COVID appropriate behavior, like wearing mask, washing hands, hand sanitization, and maintaining social distancing. So even if there were few who were not following, but the majority has listened to it, and surely the corona will go one day, but not now. This is the time where one has to be extra careful, because we get little reluctant in following these behaviors, thinking that corona incidents or less number of cases are coming, and then we can see the peak again as it is happening in Western world. So one has to be extra cautious during these days.
All right. Thank you so much, Dr. Uma, for joining us and answering those questions.